reason why you're taking our picture?
No, don't worry.
Yeah, I just don't. I mean, this is just it's political theater, right? How many people here have health insurance?
I voluntarily do not.
Voluntarily do not. How is that? You chose not to have?
Because I actually pay less at the doctor when I say I'm self-pay. What they charge you when you go in with insurance is about twice what I pay in cash.
I understand all the discounts provided for insurance.
Other than that, you just don't get sick that often. I'll spend more. I can see myself.
Is getting sick predictable?
No, but you know what I need is one of those catastrophic. That's what I'd like to have. For the cancer or the fall off the roof and you can't work. Disability and catastrophic. The other is just, it's not financially reasonable for everybody.
You're here for co-insurance? You're here for co-insurance? No, I'm not for the Baucus Bill. I'm not for the Baucus Bill. No, I ran for Congress in the last 2 election cycles in District 5.
What's your name?
John Russell. Okay, I was in the general election. And I'm a nurse practitioner. I'm the health systems manager. I have a plan that I put together, Medicare for all. That's why progressives are not largely in favor of what's going on with the Obama plan. Obama is getting caught in a lot of double talk. First, he's not going to sign a bill that is absent a public option. I'm saying the public option is it's debatable. It's not necessarily the suspenders or the adults.
I think it depends on who he's talking to.
Well, he's talking to America. Whenever he talks to America. And the fact of the matter is, when I analyze the propaganda that's coming out of all sides, especially a commercial there's 2 commercials from the same organization called American Hospital Health Insurance Plans. One of these, there's a political issue that pops up. We have these organizations that no one's ever heard of that are advocating each other. And the basic narration in those commercials is when all Americans have health insurance, no one will ever be declined again for pre-existing conditions. Now, that's the trade-off. The person willing to trade that off if there's a mandate that everyone who can afford, maybe is in excess of 50% of poverty level, afford to purchase private insurance, corporate insurance, under penalty of the IRS. Okay, that's not what I'm for. When we talk about Medicare that has fiscal problems out in the future, debatable, 12 years, 20 years, whatever it is, the way you fix Medicare is by offering a Medicare for all plan where not free health care, where people that are working pay a premium, a tax, whatever you want to call it, they pay some sum that's affordable based on their income into the system.
It's still run by the government.
Medicare is just a finance. All we're talking about is financing. We're not talking government-run health care.
Shouldn't you call it something else then?
No, because
when you hear Medicare, you hear government.
Over a quarter of America is covered under some form of single-payer health care right this minute. Whether you're talking the veterans, TRICARE. If you ask any TRICARE recipient, a career officer, a career person in the military, and you ask them, would you ever consider trading your TRICARE for Aetna, Humana, Blue Cross and Blue Shield? They would fight to the death for that. Absolutely not, because they get good quality health care. I've worked in the VA system as a nurse for 20 years. I've spoken with a lot of people. That's not the only place that veterans show up when you need health care. Bottom line is there's a lot of propaganda. The death panel thing is anybody who works in a hospital understands that in the admissions process, when you're admitted to the hospital, and I know because I've done this, we ask you if you have a living will, if you have a health care surrogate, etc. That's the part of the first step, mandatory yes, no. Do you want to make one? Yes or no, that's it. If you want to make one, we'll help you make one. Nobody's forced to do anything. All they were talking about, and you can agree or disagree, is about
the age.
what's 5 years canceling the age. That was a Republican that formulated that.
You say that you're for, since there is a private citizen grant healthcare legislation, what does it matter what you're for?
I was a candidate for the U.S. House of Representatives.
You're a
didn't you?
private citizen.
I know I am.
So
but
how
I
are you going to grant healthcare?
How am I correct? I'm offering as a professional, as a healthcare professional who has political experience, who has run for Congress and run against a person who is bought and paid for, is most of the Congress of both parties. If anyone doesn't agree with that, you're not paying attention. It's about the $1.5 million a day that's being dispensed by the insurance industry, by Big Pharma. Let me just tell you this. As a candidate in 2006, I was approached by a lobbyist from Washington, D.C., Mr. Ken Freeman. He in our final conversation, he said, John, if you're willing to go along, work with, play ball with the pharmaceutical industry, we'll get you all the contributions you want. And I said, my credibility would be gone if I were to go for that, because that's exactly what my opponent does. So I am, for a single-payer plan. Single-payer meaning 25% of America approximately is on a single-payer plan.
Okay, hold on. I'm in the healthcare industry as well.
Yeah.
Okay, I work